It's a very good on and all. First of all, I have to thank the organizing committee member for this wonderful opportunity to speak the various group of people. I think so. I think it's a combination of all disciplines. Correct, ma'am?
Hello.
Am I audible to everyone?
Yes.
Is
Hello.
clear? It's visible? Fine. Good. Okay. With your permission, I can start now. I think so. Once I start this topic, everybody will be astonished. What is this topic? Is it new? Little bit different? How is going to helpful for us? Everyone they think about this one. Just read the topic, then you can able to understand why I have chosen this topic for this session. I think so it's relevant to a recent scenario. Now we are experiencing so much hot climate. I think so. So how the impact of climate change is going to affect your mental health? That is the topic. Why we have chosen this topic means we have done a lot of research regarding mm, adverse mental health and also health disorders. But this etiology, effect of climate change, how is going to affect an individual mental health? Very few literatures were available in this world. Very few people only they have done the research on this. But this is invisible, but is now emerging. So that's why we have chosen this topic, how is going to affect your individual health. So coming to introduction, I told you why I have chosen this topic because of now this climate change is emerging in 21st century. There's a lot of adverse health consequences. Everyone in global warming, they know that is going to increase the temperature. Particularly, you can see this is going to reach at 2100
Slides are not moving. Slides are not moving.
now.
No. Slides are not at all moving. Only your original one is there.
Wait a minute, sir. Now it's moving.
No, not yet.
This one.
No.
This is the first one. I am going to start. It's moving now. You are able to see this introduction
No.
slide
No. No.
now.
Now it is okay. Yeah.
Ah,
You have to expand it if possible.
now
Good.
it's okay. Fine.
Now it is
Ah,
okay. No.
okay, fine. So that's why we had to justify that why I have chosen this topic for discussion today, because this topic will be negligible. Mostly everyone is ignored. So that's why I have chosen this topic for today's session. Nowadays, you know that everyone we are experience climate change like everywhere too hot, dusty. There's so many cyclones are happening everywhere. So that's why we need to check that how is going to affect the individual and society mental health. So that in this point of view only we are going to discuss some aspect. So according to the statistics, you can see that at 2100, the global temperature reach is increased 2.4 to 5.8 degrees Celsius. So it's going to increase, not decreasing. It's always going to increase. So it's going to affect this negative effect of this climate change, particularly affect the individual's mental health. Physical health also is affected, which is because physical health and mental health are interrelated. If somebody they are having physical ill health, then automatically it's going to affect mental health. Somebody they are having mental ill health, again is going to affect physical health. So both are interrelated. So that's why we need to check both. So recent literature, research studies, they have shown that some of the new terminology came here: climate anxiety, eco anxiety. Then one more concept is solastalgia. I think any one of you heard these three concept, three names: climate anxiety, eco anxiety, and solastalgia. Anyone? So
First
why we are
two I
going to
heard,
introduce?
but
Oh,
not the last one.
last one, solastalgia. Okay, the new terminology. That's why I
No,
given the
no.
definition for that.
Yeah.
So solastalgia refers to distress caused by the transformation or deterioration and degradation of one's healthy environment. So one person is living
Yeah.
very peacefully, healthy in particular environment. Any kind of distress which is going to affect that condition known as solastalgia. So that is the new terminology
Okay.
now came for this. So climate anxiety, the name itself, we can easily find out because of the climate change, the person getting anxiety. Anxiety means they are having apprehension. Eco anxiety, this would be, you can be able to see that ecological factor, how is going to produce anxiety. There is eco anxiety. Then third one I just now described, so nostalgia. So these are the three important new terminology. All of you will have to remember it in future. Okay. Nowadays, the ambient temperature is increased, automatically is going to link with mental health. So what kind of disorder the person is going to get it? Mostly, whenever the temperature is increased, the person is more aggressive. They are irritable. Sometimes they will get violence, conflict. Most of them they will migrate from one area to another area. The lacrosse, very rarely they will go for suicide. These are the different kind of mental ill health will happen whenever the temperature will be increased. The most common type of this one is heat stress. Everyone knows that those are working in environment or workers occupational disorders. Some workers working in farm, mines, factory, so they are more prone for this kind of heat stress, which is leads to some kind of mental distress. Okay. Now, recent studies also suggest that the heat stress and heat waves all associated with this post-traumatic stress disorder and mood disorders, anxiety disorders, and dementia. I will explain what is post-traumatic stress disorder. Once they are having any bad experience in their life, so that trauma happened. So when, for example, one person riding the bicycle or scooter on the road, one particular point of area he's going to cross when he already had the accident in the particular place. So whenever he is going to cross that particular place, his mind will be automatically waving. Then heart rate will be increased. His hands are drummer will happen because of previous experience. He had accident the same place, so whenever he is going to cross that particular area, he will get the same thing. So that is known as post traumatic stress disorder. This is very common and everywhere. The mood disorder, you know that suddenly they will change um, their mood. Anxiety disorders because of the apprehension, and everywhere they will go for anything as phobia. Mostly they are getting any kind of phobia. It's going to anxiety disorder. Dementia, I think dementia, and you know that now, so they will forget. So memory is going to relate with memory. So dementia also happen because of this heat stroke. So this picture depicts that how the climate change is going to affect your total health. Total health means include physical and mental. So in this picture, you clearly mentioned that, see, whenever any problem happen, severe weather changes, mostly is going to include injury, physical health problem, air pollution, asthma, and cardiovascular disease, and also is going to affect the vector, small bacteria, virus is going to be changed. So many diseases will come, new disease will appear. Sometimes increase the allergen leads to respiratory problem and asthma. Water quality will be very poor, they will go for cholera, then diarrhea. Then you can able to see that the quality of the food material will be reduced, that's why the good malnutrition. So this is the factor we are going to make it environmental degradation. So once in the environmental degradation happen, the person is going to move from one place to another place because that place is not convenient for them. So this is going to affect the mental health. Okay. Then extreme heat, just now we discussed, is going to produce cardiovascular and renal problem. So how this cardiovascular problem and renal problem happens whenever that heat is most we going to increase, is going to reduce the body water content, leads to dehydration. Once the person having dehydration is going to increase the clotting mechanism of the blood. That's why the person getting cardiovascular problem, stroke. Then also how is going to get renal problem because of the water going to be very less. So kidney is going to try to conserve more amount of water, but it's not possible. That's why the frequently they are not drinking adequate water. They will go for renal failure. So extreme heat is going to affect particularly physically cardiovascular and renal problem. But we are going to talk about this one now, environmental factor, which is going to produce mental health defect. So this picture you can able to see this one, how is going to affect all health, physical, mental, and community health. So any kind of climate changes, maybe air pollution, forest fire, or rising sea level, temperature increase, or extreme weather, whatever may be, is going to affect physical, mental, and community. Community means social. So you know that so many physical defect happens, particularly I told you cardiovascular and renal problem, and also is going to affect your uh, respiratory problem. Then mental health. This is the factor we are going to concentrate now. So most of the person they go for stress, distress, anxiety, depression, the feeling of loss, tension. Then some people they want to overcome that, they will go for substance abuse like drinking, alcohol, smoking, etc. Then post-traumatic stress disorder. This I explained what is post-traumatic stress disorder. Already the person having previous bad experience, they will keep on thinking about that. That's why it's coming post-traumatic stress. So these are the very important mental ill health happen whenever that climate change will happen. So this slide is going to explain that different age group how is going to affect the climate change. For example, starting from pregnant woman, the fetus is inside the mother. Then the once the delivery happened, it's going for childhood and adolescent stage. Then after that, adulthood or adult. So you can see that is going to affect all three stages of their life. Start from mother, infant, childhood and adolescent, and adult. You can see this one if we are going to diagnose or screening or we are going to take intervention in the early stage, the green color. If you are going to do the yearly screening and yearly adaptation, what is mean adaptation means we need to educate them properly. Okay, now summer is coming, so we need to take more amount of water. You have to dress like this. We should not wear tight clothes or very thick clothes. Some frequent urination will be there, so you have to drink more water because less urination will be there. So like this, we need to explain properly, educate them properly. Then intervention is taking place. We can able to prevent this kind of problem. That adaptation means educated through education only it comes adaptation. Some people they adapt very early. Some people a little bit take time. Depends on the product. So once they are going to adapt very early, they can able to survive. Once they are not able to take adaptation, it takes a long time means they may feel with both physical and mental problem will come both. So start with mother, and you can see this. So once is going to transmit all the age group, we need to start early adaptation and prevention. We can able to keep them in normal level. If you're not doing any early adaptation, late adaptation, so some people they are not getting early adaptation. It takes time. So what happened? They will have more high risk problem. They are vulnerable population for climatic change and also is going to produce physical and mental ill health. So depends on that. If the person is taking early adaptation and intervention, they are low risk. If they are not taking early adaptation and intervention, they will be a high risk population. So that's why we need to advise, educate through early adaptation and prevention of climatic changes on mental health. So these are the vulnerable population. They are not adapting early. So you can able to see this flow chart, how it is going to affect both different kind of natural climatic changes. Extreme rainfall, you know that slides, landslides, floods. So many heat waves already discussed. These are the etiology or causative factor for producing disasters. Is going to destruct a single man or family or socially, globally, nationally, internationally. Everything will come. So that's why it's going to affect everything. So once the destruction happens, those who are going for vulnerable population because they are not having any early adaptation or education, they will go for psychological disorder. Particularly, they have distress, psychosocial burden, lack of support, poverty, puts insecurity. So many things will happen here. This is going to be sustained, then they will go for other effect of mental health. Particularly, for, I have discussed this post-traumatic stress disorder, mood disorder, depression. Mostly they will go for depression, anxiety. Okay, cognitive disorder. Cognitive means the person's of thinking and also memory. So thinking, memory also is affected because they are under stress, chronic depression. So that brain is not working properly. Particularly, they will forget their memory. So that's why that leads to dementia. Dementia is mainly due to because long-term stress is going to affect the brain. That's why this dementias happen. Then very rare. But if the person is going to be sustained for longer duration, then they will go for aggressiveness, suicidal ideation. Then they need for hospital admission. Okay, I told you the new diagnosis, solastalgia and climate anxiety. These are the new terminology now they introduced because of this. mm, This climate change is now coming one of the emerging problem of our society, but invisible. No one is going to see that any problem happen. They will ask about what is your family problem, what is your personal problem, like this, what is your financial problem, like this only they will ask. But no one is going to ask that where you are living, how you are living, how is going to be, how you are going to work occupational disorders, how is going to be affect your mental health. They know, so no, the very few people they are addressing this kind of problem, but is be emerging now. But no, that's why we need to concentrate this kind of issue happens now because we know global warming happens, so increasing temperature. So that's why we need to concentrate this aspect. So how is going to contribute adverse mental outcome in that? In five or three factors, very important. How is going to happen? Mostly direct trauma and stress from the extreme weather events. Yeah, depends on the type of natural disasters, maybe hurricanes, flood, wildfires, or heat waves, which is going to affect their mental factors, particularly anxiety, depression. I told post-traumatic stress disorder will happen. Second factor is displacement and loss. So those who are affected, they want to displace their occupation or homes or livelihood. They will transfer from one area to another area, one village to another village, one country to another country. Like this, they will go. So once they are going to move this kind of migration, they they feel hopelessness, helplessness. That leads to depression and anxiety. Then very important thing is financial problem. So economic instability will happen because because of they are having more stress, anxiety, depression. Some kind of uh, working population like agriculture and fishing, they are more affected this kind of climate change. Health impacts mostly is going to affect physical and mental. Physical, I already discussed, whenever the person is going to be happen, heat stroke, cardiovascular, renal problem, etc., etc. But apart from that, is going to affect your mental health because of when started acute means short duration. Your brain is going to you are going to learn how to adapt the situation, how to educate yourself, and you are going to prevent this one. It can be possible, but you are not having the adaptation early. Only you are having late adaptation. It takes more time. Then you are the vulnerable population for the climate change is going to affect your mental health. Then social and community disruption. It definitely will have because you are one kind of group. So if because of this kind of problem, you have to migrate or move from that particular community. Then you are going to live in alone or somewhere area. Isolation, loneliness will come. So that's why leads to anxiety and depression will come. Now I am going to tell about recent research and why they taken this topic for research. What is the purpose? Because of this happened everywhere, but is invisible. Just like that, we are reading the newspaper and we are forgetting that. But how much is producing impact on individual, family, and society mental health? We didn't think about it. That's why the researcher they started do the particular research on this climate change, how is going to affect physical and mental. Mostly physical directly we can able to measure it, but mental health, very few people they started for researching. That's why this topic is very important. One more option they given is the digital mental health intervention. So intervention we can do it for a lot of option is there, but a lot of option nowadays everyone is digitalized. So digital mental health intervention is very easy to approach anyone. So that's why smartphone apps are there, online therapies platform. Now we are discussing online uh, um, webinar education. Then also we can awareness program, and also we can able to counseling, cognitive behavioral therapy. Also we can do online. So this is very important platform which is going to helpful for individualized or group activity to give the awareness and also sensitize the people how to adapt early. That is very important. Adaptation comes early, then they can able to survive. If adaptation not coming early, then they will go for vulnerable population, that leads to physical and mental health. Then climate informed therapy. So this is very important. We need to inform in education. So mostly we have to do the nature-based intervention. This is very, very important for mental. So whenever the person is having this kind of problem, then we can ask them to go for uh, anyway. They are shifting. This is transient shifting is different. Permanent shifting is different. Transient means we need to ask them to go for hill station or forest. Then we can able to give the proper training and therapy. How we need to adapt everything. Then they will do. So uh, even though they can able to achieve through some practice like meditation or yoga or something, they can able to make it to prevent this kind of post-traumatic disorder, anxiety, and depression, which is going to helpful for them. So climate informed therapy means we need to inform properly. Particularly, we need to give the therapy nature-based intervention. Nature means maybe good forest, good hill station. Like this, we need to take them and we are going to give that therapy. Then it's very important policy. So the researcher has to do a lot of research on large number of population and explore that impact of uh, this climate change, how is going to affect individual physical and mental health. So what they have done the study, they have to send the report to the policymakers, government agencies. They have to make the recommend policy awareness program to the population in gender and age based. So once we are going to start this one, then also they are going to give that awareness to the psychologist, psychiatric, or mental health providers. So everything is collaborative. Once they are going to make the policy early, then it can be possible to sustain that stage. It will not go for further. Then last one is global collaboration and knowledge sharing. This happened because every country they are having own kind of problem, maybe natural disasters happen. So that's why we need to collaborate our all the countries together, then stockholder, everyone they have talked together and make policy for uh, preventing early adaptation, how to uh, sustain that kind of climate change, how to prevent physical and mental health, ill health from this complication. So particularly we can able to have some organization, the World Health Organization, then one more organization, Intergovernmental Panel for Climate Change. I think they have formed new, which is going to play a major role regarding this global collaboration and knowledge sharing between the countries. So which is going to helpful for them to sensitize and give early and screening program. So this is a slide we can able to see this one. See the different level. For example, the person's one health is going to affect by heat related illness. You can see this how is coming, leads to the trauma, anxiety, and post-traumatic stress disorder. If the air pollution happen, they are going for respiratory problem. So once because of this echo wild level, that bacteria, virus, the climate change is going to produce so much of infection. New infection will come. The food hydration, then leads to they will go for conflict and migration. They cannot able to sustain in particular place. They have to move from one place to another place. Leads to depression, anxiety, and psychological disorder. Then what happens in health system? Health okay once individual or society. Then health system, particularly hospitals, once the person getting some heat stress, so what happened? The person is getting low quality in this inside the hospital, and also there is going to be risk for infection, further infection. Then also is going to transmit one infection to other infection to the hospital. So nosocomial infection or hospital induced infection will be more for this kind of disease. Then go to the other place, housing and occupational areas. So there are also so many problems comes. So it's going to affect globally house, individual house, family, education system, then its supply system, then leads to is going to affect the government. So that's why we need to set a long-term goal is going to happen. So we need to take care of early intervention, prevention, which leads to help for to prevent that mental illness individually, globally, and also society. So ecological determinants have widely discussed extreme weather, anything will happen. So people has to know that how to adapt that early, how to change, how to accept, and how to resilience or adaptation happen in this particular place. So okay, so these are the other different type of ecological problem will happen. Whatever happens, we need to have that policy. The policy is having the screening program and also early intervention adaptation program, resilience for the different age group, which is going to helpful for them to adapt the situation early, then they can able to survive in something. So that is a global charts is comes. And you can able to see within one slide, you can able to see all those things, how it's going to affect individual, family, society, and country, and also globally. Okay, so what is the conclusion of this topic? So we need to address the mental health impact on climate change. It happen in all age group, but particularly we are going to ask that adult because they are in like developing countries like India, we are having more number of youngster population. So definitely is going to affect your in case of terminology of all kind of problem will come. So that's why we are focusing on adults particularly. So once is going to produce this implementing the policies, particularly is going to prevent the climate change, then it's going to produce the adaptation measures, that is very important. Then next one is early screening and health intervention. I already told for the particular vulnerable population. Vulnerable population means I already told that the person having late adaptation, that is vulnerable population. And I already told that if they're working in particular occupational areas, that is also vulnerable population. Some people they are living in some important areas like very seashore or hilly population or like then very hot climate. So these are the areas geographically also vulnerable population. So that's why we need to identify the vulnerable population in different kind of areas. Then we need to plan accordingly the screening program and also education program, awareness program, and how to adapt yearly. Then which is going to prevent both physical and mental health. Okay. So thank you. If you're having any queries, I'm very happy to answer for your questions.
Very nice and very informative talk, Doctor. Dr. Manivelu. We are very happy. First time we came to so many aspects of climate change and its effect on kids, adults, grown people. Thank you very much for the wonderful talk. Others can ask questions.
Yeah. Good evening, sir. Yeah, please.
Okay. Being a medical doctor, you are also a medical doctor. We know one condition. That is SAD, seasonal affective disorder. So this climate and impact on mental health is not something new. It has been researched. It is well known. But now they are trying to come with new terms so that they can market certain things in a different way.
Yeah,
always there's a commercial interest. There is a commercial interest. You can come with this, that one, this one, and then therapist, all those things. Simple. The weather is very hot, drink more water. And if you are sweating a lot, put some salt also. Like juice, put some salt. Or buttermilk, salt. That is all what is required. Nothing else. You cope with the warm or heat waves. No high tech, you don't have to go to a therapist. Oh, what to do? Nothing. And in the olden days, in the farmers in the field, they used to take the buttermilk with them, and they used to sit under the shade of the tree. All those things, same, simple old. We are trying to unnecessarily make life more complicated. That is my opinion. Thank you.
Okay, sir. Thank you. Whatever you are saying is correct because whenever you started with your journey, 30 years, 40 years back, whatever you we have that resilience, adaptation, whatever we have. Now our youngsters they don't have, so we need to reintroduce that. Whatever happened before, why we are taking this topic there for them only. So because what happens there nowadays you can see that lifestyle modification happening everywhere. So in this point of view, we need to give some awareness program for that particular population. That's why I put adults. I'm not putting old. That's why I particularly mentioned because they are the vulnerable population. Now they will be able to understand what is going on there. So
okay, Raja Jayamar, I don't know whether you have any children. Do you have any children?
Yeah, I'm having children. That's why.
How old are they? How old are they?
They are 12 years old. Sir.
Okay, at least try to make sure that they don't drink all this soda. At least as a parent, just encourage them to drink, make a habit that is in the hands of the parents and grandparents. Some lime juice and fresh lime juice and the buttermilk and drink that one. For that, you don't need any future generation. It is not for all the old person, even the young generation. That is what is required. Common sense. That's all. Nothing else.
Yeah, correct, sir. Thank you for your information. But that's why we focusing that particular age group.
Yeah, thank you, Venugopal, sir. Yeah, you rightly mentioned our young generation, they won't drink water or lemon juice or buttermilk. They're more of fun of soda and colored drinks.
Carbonated drinks.
Exactly.
Pizza, burger. So they are going for a different kind of food. They are
Yeah.
having food. They are taking diet, but it's mostly small nutrition diet or disorder, that kind of things is happening.
And the younger generation, they don't have the money to pay. It is the parents and grandparents. They pay for that one. So I won't point the children. It is not. I will point all my 5 fingers at the parents and grandparents. They are so irresponsible. That is the point.
Sir, actually, most of our Indian public now is they don't have that kind of grandparents. They are not living along with them. They whatever they are telling some advice, they are not respecting them. That's the problem for them. So that we need to change the attitude of the children. They have to give the respect to the seniors. What they are telling, they just listen and do that. But most of them they are not. What something they will tell, oh, already you are old age, why you are telling like this? They may change their topic and go. So mostly it's happened here. We are also seeing that. So that's why the education and awareness is very, very important. Comes through parents, but parents has to be educate. But I don't think so. Both parents are working; they don't have time to do that. Nowadays, they are not having uh, grandmother and grandfather. They are not living along with children. Also, that is one of the factor they couldn't able to learn from their grandmother and grandfather. So that's why we need to give more importance related to this kind of
Yeah, very cool, sir.
One more point, then I will stop. That is that the great grandparents I know first-hand experience. I know I have seen. They are visiting grandparents, and what they do is to try to get the love of the children. They bring out the candy and all the unhealthy junk food, and then they take them out and give them whatever they want. So the grandparents are the real problem is all these visiting grandparents. That's the problem. Okay.
Yeah, correct. Visiting people. They are not staying along with them. So 1 or 2 days they are coming and staying with them. They want to satisfy their grandchildren needs. They are doing like this. You are saying. Maybe it's correct, sir. Correct.
Yeah,
Okay.
thank you, Venugopal, sir. Yeah, Halimuthu, sir. Please unmute yourself, sir.
Good evening, Doctor. Very nice session. Regarding this our climate change, you told about take a lot of fluids like that. Mental health. Regarding this digital world, digital is having any effect on your mental health?
Yeah, sure, sir. Actually, radiation. The radiation is there. So we need to take care of radiation, unnecessary radiation. If you are going to use for that digital, for example, cell phone or laptop or whatever, maybe a long duration, is going to affect indirectly your mental health. So whatever we are telling that we need to use it for short duration, or whenever necessary, we can be able to use it.
We should educate our young generation to reduce it.
Yeah, actually, we have already studied that regarding this smartphone use, and they are having poor sleep quality index, cognitive function, attention memory is also reduced. So whenever they are exposing to the artificial light, they will switch off all the light whenever they are going to bed. Also, the artificial light is going to affect their health. So what happens is going to change the melatonin rhythm, circadian rhythm, day night variation. So they will always they are having this kind of particularly is going to affect female. The recent studies exposed that the more the students are females, they are exposing for artificial light for longer duration, they are more prone for breast cancer. Okay. Because they are exposing artificial light, high this alter the circadian rhythm through melatonin. So that's why we are also educating them. Whenever necessary, they have to use it. After that, they will go for normal work. So only the digital is going to help for awareness program. For example, we are using for 1 hour discussion. After that, we need to close it and go for our work. But we should not be sitting for longer duration and seeing. This definitely is going to produce your ill health, physical and mental.
Okay, thank you, Doctor.
Thank you, sir.
Yeah, friends, if you have any doubt, you can interact with the doctor.
Yeah, please. We are very happy to discuss with you.
Yeah, Prabha ma'am, are you there?
Okay, Mr. Gautamji, that was an excellent talk. The Madurai the American College of Psychology about the digital, all these things, and the mental health, especially of the children this evening. It is already over. And maybe if we contact Sunandaji, she may be able to get a recording of that.
Okay, thanks, sir.
I think no other doubts, sir. Shall we conclude today's session, sir, with your permission?
Yeah, thank you.
Yeah, it was a wonderful session. You created awareness on climatic change and how it impacts our mental health. It was a wonderful session. I hope we can see more sessions from you, sir. We thank from Yellow Pond, India, and Forest Creative Art Studio, Punjab, then Sri Deepthi Counseling Center, Hyderabad, then Flower Learning Center, Hyderabad, Sirisha Counseling Center from Kozhikode, then Mindstyle Hub from Calcutta. We thank each and every one participants. We meet next week. I think we are going to celebrate 100 session, April 12th. We can spread awareness through this.
Okay.
Yeah, it's,
Meanwhile, I will send the format to madam. You can get the PPT from madam also. Okay.
yeah, sure, sir. We can circulate in groups.
Okay. Madam.
Thank you, friends.
Thank-
Bye-bye.
Thank you. Thank you. Thank you. Good night.
Good night.